Behind time, sorry.
You're live now.
Okay, we're live on Periscope, so if any of you shouldn't be here, it's too late. We will reveal. I can't keep. How far do you want me to go?
No, just yeah, because your head. No, that's perfect. Stay there, Roy.
No,
stay there.
I've got to introduce him. People don't know he's here yet. No, he's not here. Right. Thank you all very much. For those of us who haven't met, my name is Roy Lilley, and it's my great pleasure to welcome you to our health chat this evening. It's good to see so many friends here who've travelled a long way to be here. Who's travelled the furthest today? Anybody here from? Anybody from the further north than Sheffield? Yeah. Where are you from? Liverpool. Whoa. Oh, they've changed the name of that town now. It's Liverpool nil, isn't it now? Yeah.
Sunderland.
Yeah. Anyway, it's a great pleasure. Thank you very much for coming. These ladies here, I went to did a public health gig up in Sheffield, and they all said, "We'd love to meet Duncan." In those days, they said, "We'd love to meet Duncan." They said. So I said, "The show you shall." So
all six of you.
No, 3, 4. They all had. So they've all had a complimentary ticket to be here tonight, which I know you will pay for. It's a great pleasure.
And Roy, apparently, Duncan's #1 fan from Bristol is waving on Periscope. So Bristol's watching. So
Bristol. Good evening, Bristol.
Bristol nil point. Anyway, so it's a great pleasure. If you've joined us on Periscope, thank you for joining us, and we're in for a real treat this evening, I'm sure. With the health chat events, put your hand if you've been to a health chat event before. Right? Put your hand if you haven't been to a health chat before, but there's no decent football on tonight, so I thought you might come and see us.
It wasn't last night.
It wasn't no decent football on last night, I know. Yes. I'm going to do some reminiscence therapy for the England team. I'm going to show them a picture of what a goal mouth looks like. But anyway, so our aim and ambition with these evenings is to have a bit of fun. Everybody can do a bit of networking, get along and talk to each other, and we try and bring the big names and the people with the big jobs and responsibilities in healthcare a little bit closer to the front line and the people who are out there actually doing the real job. And do you know what? It's a great pleasure. We've had some fantastic guests, and we've been very fortunate to be able to do that. But we couldn't do it without our sponsors. And our sponsors, as reluctant as they are always to say a few words, ladies and gentlemen, I know you'll want to hear. Give it up, please. Say yes if you want to hear from the fabulous Michael Thick.
Yes!
Yes!
Duncan has indulged me, and Roy somehow, remarkably, has allowed me a few milliseconds in the public light to displace him.
There was no need for that, was there?
At least you've got a jacket on, Roy.
Yes, exactly.
Good man. Duncan has famously been a very successful chief executive of a very difficult trust, and has moved to Public Health England, where he has famously said that the practice of medicine is irrelevant compared to public health. So I hope Roy will tease him a little bit about personalised medicine, precision medicine, and that kind of advance that can help you enormously rather than just putting on sweaty trainers. Over to you.
Thank you very much. There's nothing like a good opening speech, and that was nothing like a good opening. So it's my great pleasure. Please give it up. Big, warm health chat welcome to the fabulous, the unbelievable. I can't believe he's amongst us. Ladies and gentlemen, it's Duncan Selbie. I can't believe that someone who is responsible for the quality of our food has a name that's so close to sell by. But
Crucial.
But I think you've had some sport with that before.
Mainly at school.
We just discussed our school years. So, okay, well, let's go back there. Where are you from? You've got a bit of a burr in your accent. Where are you from?
So I'm from Dundee. It's on the east coast of Scotland, and I went to school there. And then started in the NHS.
What did you do? I mean, I think you and I in this room tonight are unique in as much as we're the only people sitting here that don't have a degree. Is that right?
Yeah. So I've discovered that Roy and I both left school when we were 15.
Yeah, I walked out on the day I was 15. Yeah.
And I hated school, and I've just seen that you did as well. And mainly because the Guardian actually published this, that I said I left school because of the violence. And that was just the teachers.
And I must just tell you, I've just made a film for the dyslexia people where I said I hated school every day.
Yeah.
I left on the day I was 15. I hated it. I had a fight every day, and he's just saying he left at 15 because of the violence.
The Guardian actually published it. I couldn't believe it. I mean, they've not invited me back. Actually, the school's doing quite well these days.
You haven't gone back to a prize giving or anything?
No, they've not invited me. So I sat what was known as Scottish O grades, sort of GCSEs. I've got a 16-year-old who's going through that right now, so that feels like yesterday. And then I did various jobs, sold petrol, and then I started work with the NHS when I was 17.
What did you do?
I was a clerk in the primary care division of Tayside Health Board, and I was responsible for prescription pricing. Remember? Just to give you a sense, my first interview, because I needed
a prescription in there. Was it
well, you pay these were for long-term conditions.
Yeah.
So if you had to get a lot of prescriptions, instead of buying them one at a time, you'd get a card. I don't know if that still happens.
There's a man in touch with his job.
And essentially it involved a lot of stamping. But just to give you a sense, because people
a bit like
say,
now, really.
Yeah, so people say, because I've met people over the years about why did they come into the health service, and they talk about a vocation and caring for people and wanted to do meaningful work, you know, the sort of things that, you know, there's a family connection. For me, it was because they offered me a job. My first interview was with the National Tyre Service, and the mechanic, the interview consisted of carrying 2 tyres from one end of the garage to the other. And then he said, "It's not for you, son." And then my next interview was with Tayside Health Board. So I've been in every, and I came to London when I was 19.
What brought you to London?
To get a job. You had to get a job.
Well, but you were 16 in Scotland, 17.
17.
Yeah, and then you left Scotland behind you.
Yeah, I came down to be the cashier of Queen's Hospital. People remember in Croydon?
Yes, I do remember. There's Mayday Hospital.
Well, that was the modern hospital.
Yeah, and the Queen's was in the front, wasn't it, on the main road?
That was the Croydon General.
Oh, that's
so
right, yeah.
my first night in London, when I came for the interview, I was putting up in the nurses' home. You know, you're 19, you think, wow, you know, it just doesn't get better. And all I can remember is the noise. I mean, so my first, so at Queen's, and then my next job, which was the best job I ever, you know, I was 19, 20, I was the clerk in charge of a hospital called Wadden Hospital, and they've built IKEA on it. And if I think about all the places I've been, 30 odd years now, in London, they've all shut.
That was on the Purley Way, wasn't it?
Yeah.
Do you remember across the road there was a Lido, an open-air swimming pool there?
No, I don't.
That was probably before, you know, well, I just that I was as a lifeguard there in the summer.
So our connections I never knew this.
Had a great time. This is like memory lane.
But it just doesn't, it just feels like yesterday, doesn't it?
Time just slips through your fingers, doesn't it?
And then I did various things, you know, sort of responsible for engineering and porters and catering, so, you know, all the different things.
Do you know, I mean, it is quite interesting, those of you who are regulars at Health Chats, how often it is that people in very senior jobs started at, you know, a very low level, and Mark Bricknell was the same, Peter Carter, and several others have really worked their way through the system.
Isn't it a huge strength of public service that you can do that? And many nurses, of course, have come through that route. And I was up in Nottingham today with environmental health officers who are the most fabulous people doing work that very rarely gets recognised. And most of them came through an apprenticeship route, and about how do you help people to get into a career?
The NHS still has apprenticeships, doesn't it?
Well, we're rediscovering them.
I went somewhere to present some prizes and things, so
Yeah.
we're still doing it, I
Yeah.
think. But we've lost the sort of artisan content of all of that. So, okay, so you were, so I've forgotten now, you were in Queen's, yeah? And then,
Is the interview over yet?
yeah. And then what did you do? What did you do next?
Oh goodness, I can't take. I've been in every. I forget the grades now because they've changed so many
Yeah.
times. If you like, but I went through it all.
Yes.
I spent in the mid '80s as the deputy administrator and then hospital administrator of a small hospital called Bolingbroke, which was very ahead of its time about caring for the elderly. There was a brilliant geriatrician called Peter Millard who revolutionised, the idea that elderly people didn't have to be in hospital, and actually if you got them up and helped them to get about, you could get them home again. But the really big shift for me was going into psychiatry. Now that was when Roy Griffiths had reported, remember? And I still wanted general management experience. I could have got a job at St George's, but it would have been in a medical structure or medical management, and I wanted to still get general management experience. I went into the mental health services, which is when I first heard of Roy.
We might just contextualise that.
Well, no, there's no harm in it. I mean, these things are best talked about. I spent 11 years in psychiatry, and 5 of those was the chief executive. And I don't know if it was because it was my first command, or it was just the awesomeness of that. Because everything about mental health care is about making a judgment. It's all about risk and about making judgments and about doing deals with people about what's going to happen and how you can. Does that make sense? Of course, not everything works out, does it? And when something happens, it can be awful. And I went through 3 homicides, including the killing of a member of staff in 11 months. And I know, people talk about, did you know where, when the moon, the rocket landed? I mean, by me, right? You know it when you get that word in your ear that somebody's been killed. And we had 3 homicides in 11 months. We've not had one in 11 years. It was an incredibly important moment. And if those that work in psychiatry, if you're not there for your people, the next day they've got to come in and do that job. So I was on News at 6 that night with 11 million people watching. You get the usual sort of, why did you allow this to happen sort of thing. And I was speaking to the 3,000 people that worked for the organisation, because the next day they had to come in and do it again. I was still quite young, and do you remember Strategic Health Authorities?
I do.
They got
In
created.
fact, William Wells was downstairs having his supper just as we got here.
So William Wells told me I got the job in the gents of a hotel in the Strand. Because we were standing at what do you do and he said congratulations, and I hoped he wasn't talking and it was actually quite a sad day, because I loved being in the mental health service. It was such an important, you can make such a difference, but I did feel that I was in my sort of mid-30s, I should be doing something. I should be doing something more, and I was quite anxious about it, because I'd never worked in acute, I'd never been at any other level, in any other field, and I went to see Nigel Crisp, and I said to him, I really wasn't sure whether I was right for this, and he said something rather profound, I thought, which I've tried to share with people over the years, is that what you bring is something that's unique. Others will bring what's unique, and no one will bring everything. And know what you're bringing. We can add to that, but nobody will bring everything. Anyway, I got the job. That was an interesting experience. And then I came to bother the NHS. Does anybody remember? That was the performance director of the NHS. That involved joining the civil service. I didn't know that. I didn't know the civil service was the employer. I just wanted to be the performance director for the NHS. And that was very intensive. Did a lot of good work. We did some harm. if you work nationally, you can do good things, but or you can do harm as well. And then I need to go back and get a proper job again. Actually, I've never had a proper job for at least 20 years, but if you know what I mean. And
went to Brighton.
went to Brighton.
Yeah. Brighton's a really difficult, I don't know if any of you know
No,
Brighton.
wow.
Brighton's struggling now. They've got some, they're in special measures. And
Well,
whatever
all
that means.
hospitals are in. I mean, it's
Yeah.
tough. I
It
mean,
was an
it's,
awkward site, though, wasn't it? Oh, the thing that sort of
Yeah.
struck me about the site is the geography of it. It's got it can't expand at all. It's very tight on two sides. It's an awkward place.
well, the thing about it, I had a new medical school,
Yeah.
and the Student Health Authority at the time didn't know it had a teaching hospital. You know, we used to have to make a return to the Department of Health, probably to someone like me. And there was a set of boxes, and you had to tick how many district general hospitals and so on. And teaching hospitals.
Just not
they
to
put
spoil your
many.
flow on that story, just because I remember when Tom Sackville. Do you remember Tom Sackville was the minister?
I never worked with him.
No, somebody asked him how many hospitals there were, and they said, I remember the parliamentary answer was, the number of hospitals is estimated by the number of units that submit returns. So they didn't know how many hospitals.
Well, they didn't know they had a medical school, and they didn't know they had what was a school. So it takes you 25 years to build a teaching hospital. It doesn't just happen. This was the youngest medical. The three things about the hospital: they'd had such a hard time. They were in huge debt, and they were planning further debt. And the three things that the media, because I looked at the media for the previous year. There's a daily newspaper, so there was a lot of media.
Argus.
The Argus. Three things. They said you won't get good care because there'd been an undercover panorama about the elderly care. You'll catch an infection. They had their own special strain of MRSA called the Brighton strain, well known in research circles, the biggest number of MRSA cases in the country. And they said, and you can't park. And I said, well, I'm perfectly certain one of those is true. Let's talk. So just what they didn't know was that whilst everybody hadn't had a good thing to say about them for such a long time, the mortality rates were really rather good. And when we looked, in those days we used to do them 1 to sort of 100, acute hospitals. How many acute hospitals do we have?
157.
Yeah, and they number them. That Brighton was 4th. So if you could get to the place, actually you got a good. You see that? And when I went to the local media and said, you do realise that you've got a really great hospital. Why are you more positive about the football team than you are about the hospital? And then that began. When I left, and I say this with a complete humility, and I loved that hospital. I don't know how earlier, but just stand in the middle of a fighting regiment. You don't admit, you don't discharge. You don't tell anybody that their mum's got cancer. You don't order a test investigation or do anything to help someone get to the toilet or to find, all of the things that we know affect cost and outcome. As the chief executive, that's not what you do. That's not what you do. You're in control of nothing. But you're completely and totally in charge. Does that make sense? Okay. And what I did, I've got a very able secretary called Roz, who's from the East End of London. I can't do her accent, but she came down and visited, and she says, I've been watching you. She said, you're having a laugh. You're on holiday. I've watched you. That's all you've met her, haven't you? She says, you just do 3 things. She said, that's all you do. That's all you do. You wave at people. You say good morning, and you send thank you notes. That's all you do. And I said, and your point is? Yeah, I mean, in the sense of, when I arrived at the hospital, it was 15 minutes away from complete and utter everything falling apart. And when I left, 5 years, metaphorically and actually intensely, 24 hours a day, it was half an hour. You could judge the impact in 15 minutes. And there's such tough jobs. I absolutely honour the people that are doing them. There's such tough jobs. I can hardly bear to be in a room where people are just rude and offensive about actually what these people have to do. We've got a third vacancy fact at the moment. I think it's the biggest concern I have about where and how we're going to find the people that have the courage and the capability to do these jobs. So if I bring it to current day, leading the public health system.
Well, let's finish off with Brighton. So you left Brighton a much better place than.
Well, I left it a happier place. I left it more confident, and I gave it £500 million to rebuild it, which is the biggest public sector. This is not PFI. This is proper money. The biggest public sector investment in the NHS since the 1990s to rebuild that hospital. And that could only be done because of confidence in the place. So, when I was asked, I can't remember my interview for Public Health England, not really. I was interviewed by 3 permanent secretaries.
Did you apply for that, or were you approached?
Oh, no, I applied.
Because it's a curious, it was a product, wasn't it? It's just wind the clock back a bit. It was a product of the Lansley's Health and Social Care.
It's the best bit.
To decouple it. There was, I think, a genuine and reasonable debate to be had about the extent to which we decouple public health from the health service. Now, I mean, Michael was interesting when he said the extent to which you, in your own mind, decoupled the two organisations. But it was radical, wasn't it?
Yeah, everybody know Muir Gray?
Oh, yes.
Yeah, so I phoned Muir and said, what do you think? And there was a silence at the end of the phone.
Oh, that's rare.
No, he said, if you've got any complaint about me doing this job, you need to talk to Muir, because he vived me before I went in for the interview. It's explaining to me the difference between equity and inequality. Again, I get asked that. I was part. Do you remember that pause that happened?
Yes.
And I was the hospital boss down in Brighton, and I was invited to join that. And I went to see Andrew Lansley at the time. Private conversation, so I'm not going to disclose it. But we talked about what he really cared about, and what he was trying to do was to get the Department of Health to be about the public's health. Forget public health for a minute, but about the public's health. About essentially whatever it took to improve the health of the people. It's not quite right, the quote. What I was saying about healthcare is it's actually quite a minor contribution to good health. If we get on to that, about what I mean by that we all conflate good health with further and greater investment in healthcare, and that's just not ever going to do it. And I saw. So Andrew was talking about the Department of Health actually being a Department of Health, if you like, as opposed to a Department of Hospitals, a Department of the NHS. And his vision for the public health service was that it would come in and be the Department of Health, if you like. So he saw the offshoring or operational independence or autonomy, or find your word, for the NHS. That would be through foundation trusts and through the regulator and all that sort of stuff. What he was really interested in was what would it take to improve the health of the people. And I only really got one conversation with him when I took up the role, and then 3 weeks later he wasn't there anymore. What interested me was that I felt it was going back to really psychiatry, about the things that really mattered about people's health. There's a whole lot to Public Health England which is quite quiet. I think mostly people don't know about what we do. I've got 2,700 scientists in places like Porton Down and Colindale and Chiltern, which is the residue of the Atomic Energy Authority. We deal with every pathogen, dangerous pathogen known to mankind is in our care. And these are scientists on which this country depends. And you see a very public expression of that, like Ebola or Zika. But if I told you any more, I'd have to kill you. Does that make sense? Or I'd have to at least dispatch Roy. So
Tell us more.
but these aren't.
Can I just say that's part of my objection to your great sprawling empire, is that you are responsible for everything from Portland down to pork sausages, and it's an organisation that has clear demarcations in it. It has clear silos of responsibility and so on. That it could be far less big than it is, and in that way, it would be possible, perhaps, to engage public health in a greater participation of commissioning healthcare, which is healthcare, as you say, and not fix-you-up care.
Well,
is it too big?
Well, let's explore that a bit. Okay, so I've got two duties. They're clearly choices about how you organise and all this sort of stuff. I've got two duties. And like, take this with a lot of humility, okay? To protect and then to improve the health of the people. I quite like Disney's, which is to surprise and delight children. I think mine comes next. Protect and improve. And the way that we think about protection is around the sort of historical, traditional, infectious disease, but also other things like chemicals and radiation, air quality, that sort of thing. And it is very quietly done. And the 9,000 or 10,000 incidents every year that just get managed. 90% of them are local, and they depend on real sort of class, experience and expertise, and it's international. And we play in an international, we're on an international stage. I don't have to, infections don't know any borders, they just move around. And most of that is terribly quiet, and please don't misunderstand, that is competence. Okay? If you want noise, you're misunderstanding what that's all about. The second is to improve the health of the people. And now that's a much more public thing. And
more political.
Well, it's all political because it's all about controversy. And you've got the spectrum that says you've got the tax, regulate and legislate sort of end of things, a sugar levy, plain packaging for cigarettes, you've got to wear a seatbelt, that sort of thing, through to the freedom of choice or the individual freedom to, and providing you don't do harm to another, do what you want sort of thing. And on that spectrum, choices have to be made, and us having the evidence, and we're not the owners of all the evidence, but the portal through which we can get the evidence about the biggest issues facing the public's health are the choices about where on that spectrum that's a political question. Did anybody, you're too sad to have watched me with Mrs. Hodge, the famous inquisitor?
I watched.
Yeah? Did you see the bit where Mrs. Hodge asked me, what was I, did I ever say anything controversial, you know? I said, well, we published a book, Burden of Disease, which told everybody what they were dying from. In fact, I've got a good line on that, and I could depress all of you, actually. Pretty good take on, usually about where does anybody come from Blackpool? That doesn't surprise me.
Have been.
Well, but what people are dying from, in what order and why, and they're effectively dying in the wrong order, and that's what we're sort of concerned. To scale, the two duties to protect and improve. To protect, somebody's got to do it. I think it's a public service. The best in the world do this in public service. It's called the Government Science Service, and we all depend on it, and I will defend it to the end because I know what they do, and they're very good at it. Right? To improve the health of the people is a system thing. And if you saw me and Simon, which I think you might have done, Simon and the Minister, we were sort of, every second sentence was about what we were doing together, because not one of us can do it on our own. But well, the thing about Mrs. Hodge, and back to political, she says, I said, well, she said, well, what about plain packaging? I said, well, we've published on that. But what about minimum pricing? Absolutely. And then I launched and said, well, actually, you know, why are you asking me? I mean, we've presented the evidence. We've said, we know if you did this, this would work. But you need to have the consent of the people, and that's what you're for. So when are you going to do something about it? And there was silence. I think half the people thought I was about to be taken out and taken to the tower. And she said, no, I agree with that. Because it's political. These are choices.
Isn't that the dichotomy? I mean, probably one of the greatest public health doctors ever is Thomas McEwen. I think I'm sure you would be familiar with. And McEwen wrote in, I think, '69, the extent to which government's done all it can with public health. I think he said childhood immunisation, clean water, and adult literacy. And then he said the rest is the extent to which government is prepared to interfere in the lives of ordinary people.
Yeah.
So he kind of described the nanny state long before Tony Blair described the nanny state. And he's right, because you can nudge and fudge and get people to wear T-shirts as much as you like, but it's the law that changes things. Seatbelts in cars, crash helmets, smoking in public, health and safety legislation.
But these
public
laws
persuasion doesn't work.
But these laws only happen when the public essentially consent. So let's take tobacco control. 50 years of perfect knowledge that this was going to kill 1 in 2 of us, and still is today, 80,000 a year. But it took 5-6 decades for the public to say, okay, it's time.
But I don't think it did. Didn't it take Tony Blair to go off?
No. Well, he was smart enough to take the moment. The Irish did it first. I mean, we're having this conversation about sugar at the moment. Sugar's I mean, Leicester, I want to talk a little bit this evening about local government, if that's okay.
Well, we'll get on to it. We've got plenty of time. We're here till 11:30.
Are we? I was on the 4 o'clock train this morning. I'm very proud, not in a complacent way, please don't perceive that. What I'm concerned is public health as a profession, a discipline, and expertise is important, but not the point. The point is what it takes to improve the health of the people. And that is, like I sort of say, a combination of things that you might do. So teenage conception, that we've got, you know, a whole lot to be proud of in the last 10,
very well
15 years.
Yeah.
Hospital-acquired infection, secondary education in London, dying in a fire has been halved in the last 10 years.
Longevity, 5 years
Yes,
since 1990.
Yeah, well, yeah, we published this. This is our work, and that pot chops to that. Sausages, yeah, sausages. We published that, and the first people in the world to publish it at subnational level. The two measures of what motivates people, and the two measures that matter are how long do people live. That's important, and there's been a 5-year improvement. And England has moved from bottom to top quartile in that 23-year period. Even the health, life expectancy of people in the northwest of England, which is our poorest region, is better.
It's worth
it's better than
Duncan,
Scotland.
it's worth just emphasising that again. Just say those numbers again, because when I read the numbers, I thought, wow. I mean, why didn't we know more about that?
Well, this is why I'm not. I say this with immense respect for the NHS. It's my home, my family, and hopefully my future, depending on how this evening goes. The two things that matter are how long do people live. And when we compare ourselves with the 18 other countries that spend the same or more than we do, that's the cohort. Okay, the original 15 EU countries, Canada, US, one of the Nordic countries, 18, 19 countries that spend the same or more. Over that 23-year period, England did better.
5 years.
By all of them. Okay. The other measure, which is the critical measure,
This is the bit where we don't do so well.
which is how long do you live in good health, and actually that stayed solid still. So the truth is, and this is from the science, is that people are living longer, and those that are living but in poor health. And the critical thing, without being hysterical about it, this should shock us all, is that the gap between the most affluent and the least affluent hasn't altered in 40 years, despite a near doubling in spend on the health service, 60 years of universal access, and attention that has been second to none by successive governments. Our work looks to, so why might this be? You take the global burden of disease meets Michael Marmot, people,
Yeah.
okay? Which is say, well, Michael, in a very respectful way, says, well, global burden of disease is sort of interesting, but not really, because it doesn't tell you why, or more importantly, what you might be able to do about it. And you've got to think like Madison Square Garden, so you think sort of there's Marmot in that corner, global burden of disease in the other, I'm in the middle with a bell, they come in, okay? And out of that falls priorities for the public health system. And the two top priorities for all of government remain tobacco, because it is the biggest constraint on wealth creation. It's an economic question. And the second is obesity. So what Public Health England are seeking to do, there are 5 areas in which we operate. There's the international world, and a lot of that is with low-income and mid-income countries, where children are still dying from diphtheria and measles, through to partnerships with the Chinese.
Why are we sending money and expertise to countries when we've got a huge problem in Blackpool?
Well, let me talk about Pakistan. 1 million Pakistan people have joint citizenship, UK, Britain. 1.4 million Pakistan people visit Britain every year. Pakistan legislated for a different sort of health system about 5 years ago, and they forgot to retain anything nationally. They devolved it all to the Punjab and so on. So they no longer have a disease registration system capable of picking up the diseases of childhood death. Now, they're very good at polio, because that's the World Health Organization. This is pretty good at TB. In fact, we were exporting TB to Lahore. But they cannot track, they're in breach of the international health regulations. Public Health England, this will strike fear into you, right? Is the responsible body for the international health regulations for the United Kingdom. And we've got 150 years of experience of how to do disease registration. The thing is, if Pakistan catches a cold, who gets it next? And you could say the same about all of Africa, India, pretty much Southeast Asia. So it matters.
Well,
and we're working in we're funded by DFID for 2 years to work with the Punjab government to help them, and the national federal government in Pakistan to
let's come back to the UK, because I suspect
you took me abroad.
I mean, in your strategic document, which I have to say,
You enjoyed it.
well, I'm not so sure I did. It looks like you've taken the management lexicon and just kind of sprinkled it.
Wow,
all over
in
the
what way?
place.
Give me an example.
Oh, I can't.
What bit of it didn't you
Honestly,
understand?
I'd rather poke my eyes out of this stick than have to read it again.
So you didn't read it.
It just happened.
You're like
yeah.
Boris Johnson.
Yeah, and in fact, I think I could show you. I've just got it on my phone.
So what bit
It
was-
displays very badly on my phone.
Yeah.
You need to get that sorted out. It's unreadable. But no, it's a nice tedious document. But I have to say there are some nice drawings on there. Very good. The graphics are good. And the thing that really struck me, just coming back to your, we've got these extra 5 years, but we're living with all sorts of diseases.
Yes.
There's a bit in there. There's a little kind of a donut drawing
Yes.
where, and it's about 2 sorts of genes. It's the 40% it's your genes that will sort you out, and it's
Yeah.
about 30%, I think it is, it's what you wear. It's what you do when you're in your genes.
I can see you've been reading it carefully.
I have. And it seems that the bit really that is so difficult for you that you might like to say a few words on is the bit that really needs the legislation, the bit that needs the radical change
Yes.
in lifestyle, the bit that we're just too chary, I think, about really getting to grips with.
So not everything can be a priority. So you have to choose. And what I'm seeking to do is to choose, looking at the evidence where we think we can make the biggest difference. The national work, that's all of government, for the next 3 to 5 years will fall into 3 areas. Childhood obesity, which is such a fundamental problem. You know the numbers. We're the fattest sort of nation in Europe.
We've just overtaken the Germans.
Children are
We're better at something.
well. It's really not. So when I say hysterical, people don't mean. I mean, we've all got to do. This is a whole. And we published last October the sugar about sugar reduction, because it's not just about sugar and it's not just about food. It's about a whole range of things. And there's a childhood strategy, obesity strategy, which I can talk to if you want to.
Yeah, well, let me just touch.
But can I just
can we
the other
touch
two
upon
areas,
it?
just to
Let's-
give you a
hang on,
sense.
Duncan, hang on. Let's just touch on the childhood obesity thing, because I mean this is interesting, and I think it demonstrates very well the difficulties we have with public health. It's a real longitudinal problem. It extends beyond this Parliament and probably the next. It's something that we would have to commit ourselves to as a nation. There's quite a bit in there about the sure start for the kids and a better start for children and all the rest of it. I think you've only got 10 nurses working on that programme, but it's so wound up in so many other parts of government policy that I just wonder where you will find the champions of public health in
So I
in
want to,
Parliament.
can I go, I will answer. I
Yes,
want
no,
to come
yeah.
back to.
Yeah, no, we'll take it in that
So
context.
if you take
yeah.
the 40% of what matters, whether it's dementia, heart disease, or diabetes, 40% of what matters are the choices people make about whether they smoke, drink, what they eat, and whether they exercise. Okay, and one of the things that I think is really great is that people are now talking about this all the time, and every day, every newspaper, sometimes 3 stories on the same page, all saying quite different things, all contradictory, but everybody's
Daily
talking
Express
about
are good
it.
at that, aren't they?
Well,
Red
they're
wine
all-
will you live
all
forever.
of-
Next
exactly.
day, red wine's going to kill you.
And depending on what time of day, okay? But those 4 risks, the people are talking about them as if they're new discoveries. Do you smoke? Do you drink? Do you ever exercise? What are you eating? Okay, I'll come back. The other 60%, and the big words people would use, environmental, some genetics, economic. The most important contribution that we can make to closing that gap about health, right? About how long people live in good health. So typically the gap for life expectancy is 10 years from one end of a village to another or a town, and it's 20 years in good health. The difference between Bradford and Guildford, 20 years. The way to close that gap is to help people to get into work. To have a job is a public health objective. Now, I talked about psychiatry. After you dealt with the immediacy of the psychotic episode or the bipolar or whatever the end, right? If you didn't have a job, it was to help you to get one. And if you did have one, it was to help you to keep one. We had 2 gold standards in a mental health service covering 1 million people. That's what we chose. And it was about having a job. You can say it in different ways. You can say a reason for getting up in the day, something meaningful to do, enough money to live on. This is crucial because people talk in sometimes quite rude ways about public public health. I'm not talking about a profession, I'm talking about a point, okay? The next most important thing you can offer in closing that gap is to have somewhere safe to live. I was talking to a homelessness conference the other day. Of course, that ranges from rough sleeping to, being in a hostel. But actually, just if you set that aside, just think about the importance of having somewhere where you can afford to turn on the heating and you feel safe to go out the front door. Is that right? And thirdly, this is all from the science. You can use whatever chance, but this is straight from the science and it's global. And Michael Mahamot would be going back like that, right? Is about having someone to care for and about. It's about having a relationship, affection in your life. Before, I don't want you all to hold hands and sing the sort of corporate song and all that, but you can if you want. The point is, it matters. The leader of Newcastle City Council, for those that have heard me say it, he talked about the importance of love. And I said, study on. Study, north of the border. Yeah. So we settled on affection. The important thing was that actual relationships mattered, okay? In big words, you use these big words, like personalised medicine, rare diseases, genetic coding, whatever, it matters that much. And we need some humility about that. What matters more is to have a job, a home and a friend. So when you combine the understanding about risks with those wider determinants, you can begin to make a difference in people's lives. Now, you stop me, but I know why. Let me just say child obesity, and I'll come straight back to the question. The second is air quality. This is about all of government. It's a public health concern. And the third is worklessness. There are 2.5 million people that are out of work. And 1 million of those, we think, working with working pensions, with Simon in the NHS, and with ourselves, Department of Health, we think if we go at it, we can get 1 million people back into work. That's a public health objective.
It's a huge political problem.
It's an economic
Duncan
question.
Smith has thrown in the towel on it, isn't it?
It's an economic question. The two biggest
it's a
constraints.
political question.
Well, it's all political. That's what I'm trying to say.
What I'm trying to explore with you is the link between what you do and the project. I mean, Gordon Brown used to talk, didn't he, about, I remember I was at a conference somewhere and somebody asked him, what do you do about poor people? And he said, make them rich. I mean, we all get that. We all understand
into what?
The job and but these are well beyond the purview of public health.
No, well, yes, if you pursue public health as a profession, public health, if you so councils, okay, local government.
I used to be a local authority councillor,
yeah.
and I think I want to come on and talk to you about the idea of stuffing public health up the back passage of the town hall, and most of the people I talk to hate it.
Well, what do you want me to start with on child abuse?
We'll do everything. We've got plenty of time. We've got another few minutes.
Well, should we do child abuse?
Let's talk about child abuse, because I think it crystallises the difficulties that we have. Because, okay, how you bring your kids up is a very personal thing. It's up to you. If you're doing it badly, the opportunities for the state to intervene are often very criticised. Social services can never do right for doing wrong. It's a very difficult thing. The schools have got agendas that are curriculum that are stuffed full with all sorts of other stuff as well. We've got advertising on the telly. These are all such big societal problems that I don't see. I mean, whilst I get the fact that it's in the bag marked public health, but I don't see what an organisation like Public Health England can do about any of that.
Well, that speaks to the humility point, because what we did anybody follow the sort of about the sugar?
Yeah.
Yeah.
It was Jamie Oliver what won it.
Well, Jamie's one great advocate. He followed me, actually. I went for the Health Select Committee, and I had 36 minutes of saying no. And I met Jamie at the door, and we have a very warm relationship with. I mean, he's a very smart guy, I said, well, I've warmed them up for you, you know, the chief villain. The truth is that we do these things together. So we published the evidence, which Jamie was very supportive of, which said that we did the meta-analysis of everything around the world and about what works, and we said, if you do these 8 things, and this speaks to the difficulty, which I agree with you. People lead very complicated lives, lots of other things going on in their lives. So the first thing that we said that we had to do was reformulate food at heart, to take the sugar out of the food. Where salt had been, if you like, with some singular success, but with sugar. Now, the only people that got upset about salt were the salt mines, if you like. Sugar is a much bigger and more complex product. But if you're a busy parent, what we're trying to do, saying, is that actually we need to make it easier. We've got to take it out of the food. And so the number one priority is to do food reformulation, and across 9 food categories. And in the last 3 weeks, me and my colleagues have met 38 retailers and manufacturers. What I don't know about yogurt, biscuits, cereal, and ice cream.
Sausages.
They don't have much sugar. Lots of fat. But I mean, this is whenever it's what I'm trying to convey is that we as a science agency, right? We can choose from what the evidence is where we think we can make the biggest difference. Obesity is a big example. E-cigarettes is another one. And say, okay, what can we learn from here and around the world that would help in formulating policy? And then we work with the politicians to, if you like, to get them to take this on as well. And that whole experience about the sugar reduction report and when we would produce it and publish it was all about giving the Prime Minister sufficient time to decide, was he going to take this on or not? Because of course Roy's completely right. However charming or able a health secretary might be, they cannot commit the education secretary about the importance of what happens in schools. They can't commit DEFRA about the food supply. I could go around every department. That needs the Prime Minister, much as it needs the Chief Executive in the hospital to hold things together. You need that in the PM. When the PM made his decision, and he had a choice, that was when I got happy. Now, if you're bothered about who gets the credit, then you're never going to achieve very much. I don't know what wisdom or who it was that came with this. If you're not bothered about who gets the credit, you can achieve anything. What I'd like to say to you is that Public Health England was one of the contributors to that. And
what
I
do you
know
think?
that
What tipped the balance? Do you think it was the celebrity endorsement?
No.
Or was it the wonderful work that you did behind the scenes informing the
Heaven's
celebrity?
sake. I mean, honest.
Because if we all got to go and find a celebrity,
they've got a contribution to make. But you can't be serious. I mean, I'll rip my thing off and after you can't possibly.
Are you going
be
to storm
serious.
out? Oh, go on. Go on.
No, Roy would enjoy it.
Great publicity.
He'd enjoy it too much.
Wonderful. Yeah.
I'm much better staying here. I think it's a partnership. If I take plain packaging, that was a tough one. In a coalition government, on the edge, the Conservative Public Health Minister, against all the odds, we've got plain packaging, second nation in the planet.
That was Nick that did that.
Oh, you keep choosing individuals. It's not an individual. It's if you like an army. In the case of tobacco control, it's been 100,000 voices, and you know what happens about opportunities pass you by. This was explained to me about how you got money in the NHS years ago. You go like that. Okay, the finance director explained that. And these opportunities come along, don't they? So what we've got, and I'm not claiming, but we played a part in this, that plain packaging is all about making cigarettes less attractive to the young. And, you know, the tobacco industry have found out. No, it's made of... I used to carry them around, you know, cigarette packets that were shaped like perfume bottles, slim line, because all the market research says, particularly young girls, think that's important.
Well, now you can pack it. It looks really dangerous to say, go and have one of these.
Well, the good news is that tobacco, whilst I think food's important, the sugar's quite important, I indulge quite a lot. There's nothing good you can say about tobacco. So if we can persuade young people not to take it up, and for those that want to give it up to help them, then that feels.
What are you going to do? I mean, because quite a lot of you, what you said takes us back to McEwen and the law and the role of Parliament and all the rest of it. I mean, we all know you've got to have a screw loose to smoke, but people get hooked on nicotine, and it's very difficult to do.
My father smoked from age 11.
So what next for tobacco? Because in your strategic plan, there are three things, aren't there? There's smoking, there's sugar, and there's obesity. They're the three key things. Where next for sugar?
Well, we've got to do this one first. So I think before we've got to get the strategy out. And there's lots of good stuff in it. There's a whole section on advertising. Who watches X Factor? Anybody?
Yeah.
Is that right? 8 million people watch X Factor.
It's like saying who voted Conservative. Put your hand up if you download porn.
I'll tell you a story. If there's time about EastEnders and the Prime Minister, okay? Right. But this is so at the moment, 8 million people watching X Factor. 2 million of them are children. Advertisers can do what they want because it's about the majority watching. And our evidence reviews about what's our contribution, but in that wider sort of thing, because it's the team that deliver this sort of thing, but it's got to start somewhere. Is advertising, particularly using characters, and they're very clever, drive purchasing decisions. We know this, but what we haven't got is, in a digital age with massive social media, with every conceivable bit of expertise that the food and advertising industry can bring to bear, is a major driver of calorie consumption and obesity in this country. So, and then there's a bit on promotion of food. So
where's the X factor in all this?
Oh well, is that what we want to do? Is this? Conceivably we might want to move to a number. So instead of saying a majority, we might want to say if more than X number of children are watching.
Percentage of audience?
Yeah, a number. Yeah. A number. So if more than X number are watching, then you can.
It's not the X Factor logo, it looks like Coke Zero.
Don't know, I've not ever watched it.
We'll have to get you on it.
Jeeves and Wooster's nice. Just for fun, if you're into it, is the British people buy 40% of all food on promotion. Buy one, get one free. You familiar? The next country to Britain for buying on promotion is Germany, France, Italy, Spain. The British buy twice as much on promotion than they do anywhere else in the world. Whilst Mary's doing that.
No, Mary. Well, let's explain what we're doing, because one of your success stories, alleged success stories, is that you've got an app on your phone. We can all download an app for free. God knows what this has cost. I have no idea. And you can zap the barcode. If you're watching, you can zap the barcode in a bar of chocolate, and guess what? It tells you it's got sugar in it.
Okay.
You go. Let's see if it works.
You hold it.
What do you do?
Just hold it there.
I'm holding it.
Over the barcode.
Oh. Right, okay. Now it's recognising it's the barcode, right? Bloody things never work when you want to. I'm nervous holding my hand.
Stick it on the table.
Okay. So we're going to discover here. Oh, that's right. It's doing something. It's counting the sugar. So what this is telling us, very cleverly, is telling us that this bar of chocolate has got sugar in it, and it's now saying. It says no need to press anything. It's really clever. Shall we have another go? We'll have another go because I wouldn't want you to think that you wasted a lot of public money doing this.
It worked when a younger person did it earlier, Roy.
Yes, please. So,
Counting sugar.
so
It's counting. It's counting.
okay. The reason this matters is because the British people are buying every week 20% more than they need. Look, Mary, this is really important. If you're poor, you can't afford this. So this promotion in British stores of buy one get one free, you know, because people think, well, I'll get it now. They still buy it the next week, and high fat and sugar. This is driving what's going into people's shopping baskets. There's nothing funny about this, Roy. And for poor people, that's a problem. And it's not just that it's costing them; they're eating it. And if they're not eating it, they're wasting it. Does that make sense?
We can't make it work.
So, and when Roy, just stay on Roy, bear with me. If this were Patsman, what 2 million plus people, they're not all daft, they're not all naive. I don't start with believing that people are stupid, they're not. More than 2 million people have downloaded that app. And we have, as a consequence of them, over 10 million products that have been scanned. We know what's being bought, which has allowed us to identify the 38 manufacturers and retailers, what the highest sugar products are, and talk them technically.
So
about what
it
they might
captures.
be
Okay,
able
so let's
to
understand
do.
the purpose
But it's
of
just
it. It captures the data.
I shouldn't dwell on this, but I find I love Roy. I don't know if that's obvious, and I read very much about what you do, and I've been a great admirer of your work over many years. There is a tendency to be a bit dismissive of
It doesn't work.
that thing. So
It does. We worked it earlier, Roy.
The
It
point
does
about
work.
this is because you're asking what can we do as a public health agency. Obviously, the first drop-dead priority is to keep the country safe, and we'll never get. And I'm not apologising for that, and I'm not defending
Well,
it.
let's talk about the chocolate.
It's the job that we do, okay? The second is to be a place that brings together the science and air quality, obesity, and worklessness are the three national
We've done
priorities. And obesity will be like teenage conception, or I was given an example of London, so I've done really well on secondary education. It's probably 6 or 7 or 8 or 9 things that you do.
It worked.
It's the connection.
It tells me that the equivalent of 4.4 sugar cubes in here, or 17.6 grams of total sugar. Now you're selling yourself short, because what you should be emphasising, I think, is the fact that this is just a novelty, and as far as I can see, is of no value to the consumer at all. However, what it does, and you alighted upon it but didn't max it up, it knows what people are buying, and then in aggregate you can use it as a public health tool.
We know what people are looking at. We don't know whether they've gone on to buy.
Yeah.
No, that's important, because I was asked that, and I said, yeah, it does the washing as well, you know. No,
But it's as close as you're going to get.
It's caused sufficient angst, let me put it another way, to manufacturers for all sorts of and you know, lots of, I'll call it angst about this, because people like it, and we've got 70,000 products on it. There are about 130,000 products or product lines. We've got up to 89, do we? 1,000 products. And I say it's been scanned over 10 million times, but it's
Can't
not
you
an
get
answer.
the data from the supermarkets?
Well, we do. We know there is industry data, and we'll use industry data.
You just look at Cadbury's accounts.
Well, we're sort of looking at what's in the food as opposed to on the books. So when we're looking at all of government, the bit that we can do is to set out, if you did this, you can expect this to happen. Okay? And there are certain contributions that we can make, like lead the technical bit on food reformulation. And we can do nutrient profiling, which is an important thing about children's advertising, and work with DCMS on that. But about getting home economics and awareness and other things into schools, that needs the Education Secretary. There's a whole series of things I could talk to you about this. But
I'm conscious of the time, and I know there's more ground you want to cover. Let's talk for a moment. I mean, I think
you do have it.
I think. Thank you. The benefit of this is in the aggregate, and not to the individual.
I hate waste.
No, I couldn't possibly. If you want to look like me, you've got to eat like me. So I can't eat that. What about? Let's talk about public health in local government. This takes us back, doesn't it, to the good old gas lamp? You know, when local authorities built council houses.
When you were a councillor.
Exactly. Yes. We sent little boys up chimneys. It's not been a great success, has it? Stuffing them up the back passage of the town.
Oh, well, I won't. Please, that I'm not doing that. Okay. So if you believe, you don't have to, Roy, right? But the evidence is there that what I'm saying about the wider determinants is what we've got to pay attention to. We can't continue to just watch this gap between health, life expectancy, and the difference of affluence and deprivation, and just think that, well, there's nothing to be done about it. When I'm saying, speaking to, the most important thing you can do is to help people that haven't got a job to get into work, if they've got a job, to keep it, to be in a place that they feel safe and is not going to damage their health, and in a community setting where there's some reason or purpose or place they can go to meet other people. These are very important public health gap closing measures. And this is what local government's all about. It's about people living in places. The health service is about conditions, body parts, diseases, professions, institutions, and history. What I'm talking about are people living in places, often leading lives that you might wish they weren't, but they are, and you've got to get real about that.
They're pinching your money, aren't they?
And I've visited, I don't know when you were a councillor, but in the last 2.5 years I've visited 150 councils. I've been all over the country. I've met leaders and directors of public health and chief executives in each of them. And it's apolitical, actually. This speaks to their roots. They get it. It's given them something purposeful to do. For 40 years we forgot that actually healthcare wasn't going to be the answer. We've got to rediscover. These characters that stood in the middle of an appalling situation and said, right, I'm not leaving here until this is better. And that's what I'm creating. So it's different. I will not speak ill of what public health have done over the years, because Britain, if you go to China or anywhere in the US, you go all over the world, they look at us and they say, right, whether it's screening or immunisation, second only to clean water, disease registration, best in the world, cancer, the best. I mean, we've got the best cancer registry on which all cancer research depends in the world. But what we've forgotten, and public health has forgotten, that we've all forgotten, is that if you want to change the profile of health, if you want to close the gap, if you're interested in helping people to close the health gap, you've got to get back out onto the streets and back into communities. You cannot do that from Whitehall, and the NHS can't do it. It couldn't ever do that.
What's happened to all the sexual health money that local governments have? They pinched all that, haven't they?
Well, the NHS, of which I'm part, okay, so this is as in, I can't sit and just be smart. It's actually, we didn't know what we were spending on public health. We simply didn't know because we'd never asked. And it wasn't until Andrew Langsley said, I want to do this, okay? And I think it was the best bit. I forget about the rest of it, but the best bit was remembering that public health, it was all about local, needed to be back in local government. We had to ask 3 times of the NHS to discover what was being spent. And we discovered there was a 7-fold difference in what was being spent. Nothing to do with need or any formula, simply history and choices that people made at a local level. 7-fold difference.
Local choices, okay.
Take a deep breath. So 7-fold difference, no connection to need. We took that money out of the NHS and we gave it to local government. The best thing we could do, all we could do, was give them what had been spent so that at least didn't start with less than had been spent by the NHS. Does that make sense? 75% of that pays for drugs and alcohol, sex, and tobacco control. On top of that, you add school nursing, which is about another 10%, and then a few other things. Actually, it's pretty much spent. It amounts to about 3% of what the NHS was spending. And the NHS thought that was okay. The NHS thought it was okay that there was a 7-fold difference, and the NHS was not bothered, because I was the performance director of the NHS, bothered about the gap in health or life expectancy. Nobody ever asked. No, but I'm giving context, okay? Nobody ever asked.
So you know how much they've pinched?
Well, we do, actually, because we didn't before. And in 2005, when I did the turnaround, for those that remember, the NHS overspent by £500 million, and I became the finance director for the NHS for a year, counts for a great deal. The then Chief Medical Officer dedicated an entire chapter of his annual report to the devastation and removal of public health funds from what would be PCTs. In 2011, the Health Select Committee took a report that said that public health had never been safe in the NHS. And that's why we had a ring fence between the money and all that. But I am very sad I did not win the argument through the spending review. I won a better outcome than would have been, but I didn't win the argument that the public health service would be protected, if you like, from the spending review. And what we eventually agreed, what I eventually agreed, was 9-point-something% cash over 5 years. I regret every penny of it, but in every year that's about 2.2%. And I know local government thought that was a better outcome than they had than they were planning for. And I'm not going to defend or be an apologist for removing anything from public health, but I think, given the circumstances of the spending review, the decision to put the money into the NHS and to drive down public expenditure, a 10%, a 9-10% removal over 5 years, is the best outcome I get.
It looked like a half good deal. I mean, now
It wasn't. It was the best. It was the best deal I could do. Do you know the only difference? I've sort of learnt this over the years about people say, about us actually, about that negotiation, was that I was there and you weren't. So I know what it took to get that deal. Now local government are well used to managing on less, because they're the most ruthlessly fiscal part of public life, and nobody could say they've not done a really great job in straitened circumstances for years now. And the public health services that transferred into local government, by and large, hadn't been looked at by the NHS for a very long time. So the NHS didn't pay attention to sexual health services or drugs and alcohol services. And of course local government will, because that's what they do. And they've looked at this and they've looked to find efficiencies. So my line with local government is that the scale of ask of them over the next 5 years of itself is no reason to be disinvesting in anything. because there's enough, if you just do like for like over a period of time, you'd expect to make efficiency savings, you'd expect to find. The truth is that there's a whole lot about how we've provided these services that people want to do differently.
I think it's interesting that Simon was saying at the conflict that if there's any more money around, give it to social services.
Yeah, I agree with that.
I think that's probably right.
Yeah.
Okay, one more question. Do you think Shirley Kramer was right to push for legalising drugs?
I prefer the Brexit question. I was quite good at that. No, I don't know. I think there are. There are very competing arguments about this. And if you just deal with demand and you just deal with supply, then you won't deal with it, if you like. We have to be concerned for both. And we've been concentrating on getting people into treatment.
But that's your argument about the NHS, isn't it? It's a fix-you-up service. Public health should get upstream, stop all this stuff happening.
Yeah.
Look at the evidence. Well, if you're a big man for the evidence, look at the evidence. Was it Portugal and somewhere else you're saying? The evidence is clear.
Well, I've not looked at it. I've not looked at it.
But Shirley has.
Yeah, I mean, I get the concern not to demonise using drugs. And I'll come back to it, but just to speak to local government on drugs and alcohol, 3 years on, we've got stable recovery rates. Actually, they've remained stable over the period, but access into treatment has improved hugely, and 90% of people get in within 3 days, which is quite remarkable. We haven't looked at. You will get me to talk and to speak to the evidence, the truth as we see it, about work that we have done. So on sugar and e-cigarettes, but I haven't looked at this. We haven't looked at this.
Are you going
for me to know.
I mean, you've got a major public health organisation, two major public health organisations that are pushing and saying we should do this, and you're not planning to look at it.
No, I'm not. You have to make choices, and about how you, because the public's health, if you like, is as wide as can be. So, what we've said we're going to do for the next period is focus on, what we know is destroying lives at a scale second to none in the world, and that's obesity, and particularly for our children. We're going to continue. We're going to get much more involved about air quality, because we think this is, more people expire early from poor air quality than cold weather. I mean, how many people know that? And we need to be more concerned about that. And worklessness, which is, as you say, Roy, is a hugely important issue. The thing about drug and alcohol abuse is my job right now is to make sure people get access to treatment. If we were to look at the health impact of drug and alcohol services, actually that would show, of course, particularly for alcohol. Well, we are doing a review of alcohol. I'm just tired, sorry. We are doing a review of alcohol, an evidence review of alcohol and the health impacts of alcohol. And we'll publish that later this year. It'll be a similar sort of.
Drugs destroys lives. It
No,
destroys
so I'm
community.
just,
It fills our
no, you're
prisons.
quite right. But I was saying we are doing the work. It's out to peer review at the moment about alcohol harm. We're not planning to do that about drug harm.
Okay. Right, I'm just conscious of the time, and I want to give the opportunity for our guest to ask any questions. I suspect this gentleman here is going to ask about finance. Do you mind telling us who you are?
Yeah, my name's Chris Hewitt. I'm from Leicester and run the local medical community there.
Oh, the LMC. There's a novelty.
And it's got nothing to do with Leicester or football or money. I was at a wedding in Buxton on Friday. I met a family friend, not met for 10 years or more. She runs nursing services in Blackpool. Yes. And I said, how's that going? She said, it used to be really good. We've got conception rates down, we've got loads of traction, we're doing loads of stuff. But now we're struggling. We're doing 2 local authorities. Everything's out to procurement, and I'm struggling to keep my staff at the skills they need to be at and to keep them because everything's being done on the cheap. And she said, the good work is going to get destroyed. Which sounds like there's less money around, or the market's doing something. I don't know, so perhaps it is a money question.
Well, the margins are shot to pieces, the care home. Was it one care home a week is closing?
Well, I agree that social care is the single biggest, the most vulnerable spot is the system. I'm bound to say. I know a fair bit about Blackpool, but I don't know the immediacy of the issues. And I do know that life expectancy and life and good health in Blackpool is right at the bottom of the curve. Are they wringing their hands and sort of saying actually there's an anger about that position. And in Blackburn, which I think is really, really powerful. And actually, one of the things we didn't talk about, Roy, is that by moving public health back into local government, it's now got a voice again in councils. They don't just agree. If I think about
I'm not convinced. I just tell you from my point of view. I mean, I was on a council for 20 years. I was a leader of council. Eventually, I became the mayor. I can tell you what makes councillors' minds up. It's getting elected, and the extent to which there are votes in public health versus filling holes in the roads, I can tell you what will do.
I think that's cool. As long as
it's true.
As long as you don't feel you can speak for everyone, because I don't own the university.
No, I just said I tell you when I was a councillor, that's what we did, and I don't think it's changed that.
So I was in Hounslow last week. Where the leader of the council sat with the director of public health and ran through 6 or 7 areas where they were transforming for local people, not just in the conventional areas like school nursing and thing, but actually getting people back into work. There are schemes all over the country that are doing twice as well as DWP in getting people back into work, because local matters.
Are there any public health?
Public health in
the vanguards, isn't there a public health vanguard?
Well, public health runs through it all. It's about the two forms of.
Yeah.
Well, I met most of them yesterday, because what you're trying to do, if you conflate this public health bit, is to try, if you can, to get people out of hospital just as soon as you can, in a way, or to make it so the default isn't the hospital. Give the hospital a break, really. And the other is about how do you help prevent it in the first place. And the vanguards are more about the former rather than the latter. And I'm obviously...
There is a vanguard, isn't there?
There are vanguards that are all about how do you avoid people getting into
we have them on the Academy of Fabulous Stuff, and I know there is one. I just wanted to call to mind there was one particular one that was focusing on public health, which I thought was really worth mentioning. Can we ask Sheffield now? Sheffield bring collectively a great deal of wisdom about public health and charm, and a tricky question or two, I would have thought. Or are you just beguiled by this man?
I doubt that.
One question for me is about, you talked about local government, and I'm a registrar, so I've moved around
Yes.
council, and they're obviously not all the
You just can't tie them all with a...
No, but I mean, you visited a lot of councils,
Yeah.
but I think they tend to tell you a lot of the time probably what you'd like to hear, certainly the councils that I'm aware of that you've visited. And there are things on the table now because of the cuts that perhaps Public Health England wouldn't be so happy about. So health checks is one that I know in 2 councils is on the table in terms of can we reduce this, can we get rid of this. What PHE to me doesn't seem to have any teeth when it comes to actually holding local authorities to account for some of the decisions that they make. And the ultimate sanction in terms of decommissioning something like health checks would be to withhold some of the grants. But when the grant goes and it's business rates, what will happen then? How do you be more of a critical friend to local authorities?
Well, there's so much in what you're saying there. Public health grant for Sheffield is about 32 million. The spend of Sheffield Council is 1.4 billion. And the public sector spend in Sheffield is 4.5 billion. Okay? So I'm concerned for the 4.5 billion and about how that's working for improving the health and well-being of the people. The public health grant is an enabler and a lever in the scale of that. I could go around the other cities and give you similar sums. On my visits, I've been around for a while. I think we established that at the outset. I have at least 15 minutes, sometimes longer, with the Director of Public Health on their own, nobody else there. And we talk, and they tell me stuff about good and thing. I do, and I've spoken to your Director of Public Health very recently as well. Of course, they're all involved in difficult decisions, and they can't be immune to the wider fiscal position of councils or for the NHS in many parts. What I'm really glad about, apart from structurally I think they're in the right place, is I want them in the room having the argument. You know, sleeves up, having the argument about the priorities and the choices that have been made, rather than where they were before, which was on the outside commenting and writing an annual report every year, essentially saying it's just gone worse. So this is harder than it's ever been before, because you've got to be in the room involved in the discussion. If you're concerned with, I don't mean you, but if you're concerned with your little bit, you miss the point. And I know there's not a Director of Public Health in the country that isn't involved in difficult discussion. To the point about, say, a health check and making sure that we maintain that and improve that programme is something that I will ensure happens in every part of the country. I will also ensure that the 5 checks for the very young happen. You know, the universal checks just after birth, and what are they? Up to the 2.5-year check will happen in every part of the country. Will there not be a part of the country that has brackets? We simply can't do it here, okay?
So
and that's
how will you do that? How will PHE do that?
Well, we do that all the time. It's a bit like the health protection piece that says because we're not out making a big scene and, you know, shaming people, does not mean that those conversations not being had, but they're being had in a way that is seeking to understand the context and the difficult choices that people are making. I hope it's been obvious that I'm not looking for a continuation of what had been. If all we did was what we'd always done, then why did we even bother? So I think it's really important that people do look at what they're getting for their money. There is less money, so they've got to make difficult choices. And I want the Directors of Public Health and their teams in the room having those arguments. The Director of Public Health in Sheffield, until very recently, his office was right next to the Chief Executive. When I go out and meet the councillors, I always meet, without exception, the Chief Executive. In most cases, politically, the leader or the cabinet member or whoever happens to be in charge. But the Director of Public Health is no longer a visitor in local government, but a core part of that.
But I think it's a fair enough question, isn't it?
It's
I mean, there are 300 local authorities or wherever it is. You know, if you're going to rely on having the conversation, some of them will be successful and some of them won't be.
Yes.
You won't be universally successful. We don't know what the percentage of success versus failure is going to be. And as you very persuasively made the point, some of these public health issues are such an imperative that there ought to be teeth. We ought to be saying, people, you bloody well do this.
Well, I was the performance director of the NHS for almost 5 years. I don't think I've raised my voice or shouted or in any way, but we landed every target expected of us. Remember those years? When you waited 18 months to get your hip fixed, people forget.
Was that before or after Mark Britnell? I can't remember.
That was before Mark Britnell. Those were really difficult years. I mean, we achieved a huge amount in those years. We know how to get things done.
Well, you do.
But we don't get them done through shaming, or we start by understanding what people are seeking to do, and we get alongside.
But why does it have to be shaming or any of that? Why isn't it simply, this is a national imperative, here's the guidance and the regulations, get on and do it?
Well, might work for you.
Well, it works for government.
Well, not really.
Don't you think so?
What? Telling people what to do?
I think it works pretty well.
It might do it once for you. What I wanted to reflect back to you was the normal distribution. I mean, I've yet to find anybody capable of denying that the normal distribution happens. Okay, so it's 152 councils, and of course the normal distribution applies. And what I'm trying to do is to move the mean north. Okay? And it starts really with a narrative, telling a story about why this matters so much. And it wasn't about really absorbing a public health function. It was about becoming a public health authority, and about remembering that actually what matters is, and we've touched on that a lot, and that public health in that environment is not anything recognisable the way it had been in the NHS before, and it's a different set of skills. And I've got a small number of people that are distributed around the country that relate to cohorts of local authorities, and they have those relationships. And I was able to go before the Health Select Committee a couple of weeks ago and speak to different parts of the country where we were concerned. So, for example, we've got issues about cervical cancer screening, we've got issues about breast screening, we've got issues about sexually transmitted infections. We've got things that are going in the wrong direction. But if you look at the Nuffield did a piece of work with I don't think it was for the King's Fund, but they published recently about the public health system. The first 3 years took 20 indicators in 5 areas: obesity, tobacco, screening, and they looked at how had things gone 3 years before, 3 years after on these 20 indicators. Of the 20 indicators, 10 were improving, 4 were stable, 6 were getting worse. And of the 6 that were getting worse, 4 of them were sexually transmitted disease. One of them was alcohol admissions into hospital. And I can't remember the other, but the 10 were getting better, 4 were stable, 6 were deteriorating, 4 of them in sexual health areas. It was not a bad story for actually a very early, by any definition. If we'd been at this for 10 years, you'd say we just got started. But 3 years in, the sort of apocalypse that sort of said that things would be, fall over, it simply hasn't happened.
Well, we're going to have to come to a close. Has anybody else got any? Have you got something on?
Just on Twitter, your sugar app is getting huge. People tweeting their kids are using it. It's making a difference to what they pick and the impact.
Can I tell a little story? My son's at primary school, and they have to do these talks, if you like. And another child gave a presentation on the sugar app, and my son comes home and he didn't even mention that his dad had anything to do with it. Now the team would say, well, you didn't have anything to do with it, but vicariously I might take some sort of.
It's being
children are using it.
Leadership.
Yeah.
Leadership is not about people knowing what you do.
Yeah, that's my
right. There's two general. I'll go to the general right at the back with the spectacles, and then I'll come to you, Phil. Right? Could you be brief? Because desperately overrun.
So my first point actually was about the sugar app. My 9-year-old who was able to use it much better than you, Roy, and actually he does.
It's
Not
true.
surprising.
Yeah.
He absolutely does. You know, he influences as a result his mother's shopping. So
Can I just tell you, a great man once said to me, all change starts in the playground. Right? And do you know who that was? You wouldn't know, but I'll tell you. It was the Reverend Ian Paisley.
yeah.
All change starts in the playground.
The second point was one of my things I had to be a counsellor, and I disagree with you, Roy. I think that now it's more than just potholes. Obviously they're important, but actually public health is coming onto the agenda, and things like air quality is becoming important because people are becoming aware of it. Now it's things like it gets used in different forums. So for example, talking about building new houses, people go, oh, the air quality isn't good enough. But that at least is on the agenda, and people then have to start measuring it and start worrying about air quality. So it is coming onto the local council agendas. And thirdly, I just wanted a question for you, actually, Duncan, which is that you say the most important thing is jobs in terms of public health. But if that's the case, why is it that we have the lowest unemployment rate in Europe and have done for quite a long time, and yet our measure of healthy living hasn't increased while everybody else is clearly has? So is there some disconnect there?
Can you do this in 30 seconds?
There are 3 points in life that will tell you about what's going to happen for the rest of life. It starts well before you get a job. The first is that you're ready to learn when you start school at age 5. And I'd swap everything we've talked about this evening for getting our children ready to learn, not through the lens of a healthcare professional or the NHS, but through the lens of a teacher. Does the child know how to sit, listen, go to the loo, use a knife and fork? Half of our children don't know how to do that at age 5. Tells you everything about the rest of life. The second is key stage 2 reading at age 11. If you can read at age 11, your chances at population level of walking ASC at GCSE are almost absolute. If you don't, it's 1 in 10. It drops by a factor of whatever, from almost certain to 1 in 10. That tells you everything at age 11 about how that child is going to prosper in good work and so on. The third is about teenagers becoming adults and about having something to do. This is intuitive but straight from them. You know, what do we call it, that horrible phrase, not in education? What's it? Education. Needs. But what's the training? Education, employment or training. And not enough of our young people do. I've had a council leader in near to the Chester sort of thing. I guarantee you, Duncan, because this is like the Boris of the West, right? Every young person in will have something to do. Now, I didn't know whether I was speaking to the next Churchill or something, but that's what will make the difference. Full employment follows, okay? And it's about how you get good work. It all starts.
Now, you're all starting to wake up now, we're running out of time. Phil, be very quick, and then, unless you can do it in 3 seconds. Go on, Phil.
I love the idea of an app that causes angst. The sugar nudge, whatever we call it, would you ban low-fat labelling? Because low-fat always means high sugar.
Yeah, labelling is a European
Please don't go there.
What I'd say is that the manufacturers, see, this is, you can't just
John
be
wants us to stop, so
you can't just be a single ingredient, okay? So what we're using sugar for is to add and amplify about other things, saturated fat.
Oh, hang on, now you've started, oh, for God's sake, you've woken them all up now. Right.
And labelling is important, but much more important is to reformulate the food, because most people don't have the time to read the label.
No one can read it, and then they're all in 6-point, in little grey print, and it's beyond me. Yes, can you do this in 15 seconds?
Yeah, yeah, definitely. I was going to go for 3. I'm Tom, I'm a junior doctor working in Kent. I did my training in Wales.
Yes.
So my question is, how did England and Wales end up with seemingly opposite policies on e-cigarettes?
Because Wales is a principality and it's devolved matter.
not procedurally. I just how did they end up?
Well, we upset half the world with our e-cigarette evidence. I'm incredibly proud of it, right? because this is what, if Muir Gray would say, if you're not where others are, you're in the wrong place, okay? If you're not involved in controversy in public health, you're probably not doing your job. 2/3 of British adults think there's no difference in risk between a normal cigarette and an e-cigarette, and there's a 20-fold difference in risk. And we had to step into that space.
They smell nice, don't they? They do smell. I think they're taking it up. They smell.
So I think the Welsh, and everybody's entitled, it speaks to Roy's thing, everybody's entitled to make their own judgment. I'm not telling anybody to do it. Somebody shouted at me, I know we'll go, from an audience a year or two ago, he says, professor from London, very able man, he said, who are you to tell me when I should die?
He said, how about now?
And I thought, I didn't have that many original thoughts, but this one was one of them. And it's you to say when I should die. I'll decide when I'm going to die. I said, well, I'm not telling you. You die whenever you want, right? Well, die tonight, right? You make your choice. Not everybody's got your choices. And we've got to be concerned for the ones that don't have the width of those choices.
Right, we've got this absolutely the last question from Sheffield. It's got to be in 1.5 seconds because John is fed up.
So I'm interested because you said a really interesting thing earlier, which was if you work nationally, you can cause harm.
Yeah.
And I'm wondering, on reflection, what, if any, harm do you think you've caused working nationally?
Well, I think everything that counts, whether it's in a hospital or it's it's about what happens locally. Because whatever you think you're doing nationally, you're a long way away from actually what it's like at a local level. I was thinking more about my years as the Director General of Performance and Planning for the NHS and about what I thought I was achieving and actually some of the things that were happening on the ground. I haven't given the thought to this role and about what harm I've done yet. But you'll tell me.
Right. I'm going to have to end it. We've overrun horribly. I don't know where the time's gone, do you? It's been really, really interesting, Duncan, and thank you so much for sharing your evening with us. It's been fabulous. And our way of saying thank you is we always give our guests a little gift, and we can't think of anything more inappropriate.
Wonderful.
Now this is our regulars will know this is a special whiskey. It's Penderyn. It fuels most of my 700 words a day.
Wow.
It's Welsh whiskey. And I can't think of anything more appropriate for you, so this is why you're going to have it. But the other thing is that it is very expensive, and it's just above the level at which you have to declare. And we just love the relish the thought of it. You've been a wonderful guest. Thank you very much. Well, Duncan Mitchell, ladies and gentlemen. Thank you very much. Okay, that was Duncan Selbie. Our next guest is Sir Andrew Dillon from Nice, which will be a great evening. So we'll let you know, and there are still some tickets available, I think. Thank you and good night for watching. Thank you.